Welcome to the Deep Six podcast, where we make a generational impact on you and yours. What we do here is explore a 6-point model into your health, your life, and your journey while you're here. So let's dive deep and help you thrive, not just survive. Well, welcome again to the Deep Six. I appreciate you tuning in and of course, always bringing you the best guest possible to educate and enlighten you and just keep you thriving in health and wellness and in the journey of life. And today I got a great one. So, but first, I just want to, share with you, if you enjoy this, please subscribe to the podcast. Please share this with others. Sometimes it's so powerful and enlightening and encouraging when this is shared with somebody and we get great stories and enlighten and educate people. So this episode is going to be very enlightening and very educational and informative. So I have a guest today that is a board certified neurosurgeon that is world renowned. In fact, actually, I'll probably make him blush and sweat a bit, but actually he is 2 years in a row the top 150 neurosurgeon by Newsweek voted, besides year after year voted by Our Magazine a top doc. And the accolades go on and on. But first of all, thank you, Dr. Fahim, Daniel Fahim. Appreciate you taking your time out of surgery, 700 surgeries a year. So we were talking earlier in the show, and that's a lot of surgery. And I appreciate you taking the time and really value being here and helping us in the audience understand just structural stuff and spine stuff and the benefits and technology and that. Thank you.
Absolutely. I'm thrilled to be here with you. Looking forward to our discussion today.
Yeah, it'll be fun. So, and how unique, because, our podcast is based on the model I've kind of created in the practice, which is this functional model of 6 big systems, but one that really gets undervalued in my practice because we don't really do much with it, but is the structural system where people dealing with chronic pain. Mm-hmm. And this is where you come in to save the day. Yeah. But it's so important because of any kind of, healthcare you're delivering, you can't ignore these things. And people live in fear and misinformation and all that with sometimes surgeries that we'll get into and spine stuff that's so common. And what I've noticed in the type of practice I have where we're, doing so many wellness and health things and optimizing things and people are super happy, but gravity will always win, I think. And this is where you come in. So, but let me give you a proper introduction. So Dr. Fahim here, board certified neurosurgeon. He actually is trained and educated at University of Michigan, right? Yeah, medical school.
Yes.
Harvard, undergrad.
Yep.
Princeton.
Yep.
And you've done fellowships writing training at MD Anderson, at Baylor, at Methodist, right?
Yes, sir.
And I'm probably not going to give this all, just enough. So please enlighten us. But that's a lot of education beyond most of my most of my guests have.
Oh,
so
you're being too humble there. Of course, you're a doctor as well. You've trained at many places as well, which is every doctor has to because our training is so long and extensive.
Yeah.
But definitely, I've had the privilege of having incredible teachers throughout my life. I went to public school my whole life.
I love
incredible
that.
teachers, and I owe so much to the teachers that inspired me to keep learning and growing and pushing the boundaries and trying to gain as much knowledge as possible so I can be a source of wisdom to my patients and to help them through their problems.
Yeah, that's great. So your undergrad, though, was at?
I took one undergraduate class at Harvard, actually while I was still in high school, and then my undergraduate degree was from Princeton University, where I majored in neuroscience, which at the time they didn't have a neuroscience major, so it was psychology, but a neuroscience concentration within the Department of Psychology. So because I had always known I wanted to be a brain surgeon since I was a kid.
Oh, really?
Yeah. So then after that, I was lured back to Michigan, which is where I'm from. I'm from Michigan. I went to Troy High for high school. Came back to Michigan for medical school, and I attended there as a University of Michigan Dean's Merit Scholar. Graduated from there with honors, and went on to residency at Baylor College of Medicine in Houston, which is where my beautiful wife is from. So we went down there for a while and began our family down there. So a couple of my kids are Texans. The other 2 are Michiganders. But and then we came back here, and we've been living here ever since. So I've been taking care of patients in Southeast Michigan for about 15 years now.
Wow, that's amazing. That's great. And this is very, very, very honest. we don't know each other well. Okay, do we?
No,
We have not had dinner.
Talked a couple
we
of
haven't
times.
exactly about patients and cases and
Yeah.
stuff. So again, thank you for coming on. But you have a very, very, very excellent reputation.
Thank you.
And part of that comes from, I just want to tell you though, is because it's not just, oh, you're going to see a surgeon and you're getting surgery. It's, is it the right, patient, the right case? Is it the appropriate time? All those things, which are so important. And that's where I value, with all my patients, is because, it's a big thing and you usually can't, can't undo it.
Right.
If
right.
you will.
Yeah.
So, but let's get into what kind of what got you on the journey. It sounds like you already said this, but you knew you wanted to be a brain surgeon and a spine surgeon your whole life.
Yeah. So ever since I was a kid, once I heard what neurosurgery was and people got to do surgery on the brain, I thought that was pretty incredible. Of course, as a child, I don't really know even what that means, but I began, being interested in it at that time and looking into it and learning about it and being so fascinated by the brain. Because really, you have to consider the fact that the brain contains, of course, the mind, and the mind is the most mind-blowing thing in the universe. I mean, we can't understand or explain how the mind works, how we can do all the things that we do, from beautiful music that's composed or played to complex math or logic or reasoning or philosophy or playing sports at a high level. All those things happen in the brain before they happen in the body. The relationships we have, motives, dreams, all these things that we just barely have begun to understand. It's really the greatest mystery in the universe, and I get to work on that organ that makes us who we are, and makes us human, and makes us so incredibly unique. Even our spiritual experiences, religious experience, all those things we experience through our brain, through our mind. So it's pretty incredible. And then the spine, that's a whole other incredible part of our body. It's the foundation sort of for everything. If there's something wrong with your spine, everything else is wrong.
Yes.
Because obviously everything attaches to that part of the skeleton, whether it's our legs and hips and limbs, our arms, our neck, our head, everything is connected to that, and it serves as the core for our well-being. And so it's so important to have a healthy spine and maintain spine health, which I know you help your patients to do.
Yeah.
But once in a while, things go
happen.
wrong, and sometimes you need to have something addressed. And I would say, you mentioned at the beginning of your podcast, chronic pain. Chronic pain is a terrible thing, and it's something that we can potentially avoid if people seek care a little sooner, and have their problem evaluated sooner, so that it doesn't turn into chronic pain. Because the actual anatomical problem can potentially be addressed before these chronic pain cycles form in the body, which is just kind of a self-fulfilling kind of prophecy, positive feedback loop that ends up being very difficult to break. And if the anatomical problem can be addressed early on, hopefully that whole path can be avoided.
Yeah. And said beautifully, because that's so accurate in the sense when I've seen it, clinically. I mean,
Right.
As my base practice being family practice, general practice, before I got into the functionality and the deep physiology stuff that I do in prevention, when you saw a chronic pain patient, they were in a loop, and it's very hard to break that.
Absolutely.
And a lot of it, which we'll get into a little later, but a lot of it is they could have had something maybe done prior, and fear-based stuff. And that goes back to the mind between the ears.
Yeah.
So I talk to my kids about that all the time. And the most important thing is what's between your ears. So be careful what you're telling yourself.
Yeah, that's true.
Was there, in your journey and, education and, training and all that, was there ever one particular either person or situation or anything that really empowers you, or you just, felt so, excited about or passionate about, that really set you off?
I would say that my true passion within the field of neurosurgery is taking care of patients who are dealing with cancer.
Okay.
And I take care of thousands of cancer patients every year. Unfortunately, as cancers affect the brain or spine, I can be there to help them through that journey and treat them. But of course, the ones that stick with you the most are when you're caring for younger people, younger patients who seem too young to be dealing with cancer. And as you know, we're seeing this much more commonly in younger and younger people for various reasons that we're not getting into in today's podcast. But it's something that really touches your heart when somebody who's young is dealing with a bad tumor, and you can do some sort of incredible operation to hopefully cure them from their cancer and their tumor. And so those are the things that stick with me the most. So I can't talk about specifics, but I took care. I remember a young woman who was just engaged, about to get married, and She had felt this lump in her neck and it was getting bigger and bigger over time. And eventually she got imaging for it because she just thought it was a sprained neck. She used to actually ride horses for Henry Ford Village for the Headless Horsemen for their Halloween thing. I don't know if you've ever been to that event, but it's a pretty cool thing. But she was, she's an equestrian. She rode horses. She assumed she sprained her neck or something. And it turned out she had this massive tumor in her neck. And it's a tumor that if we can remove it in a certain way, which is in an en-bloc fashion, meaning going around it, resecting it with negative margins, and then reconstructing the spine, if we can do that, we can cure her and she can live a normal, full, healthy life. Whereas if we remove it in a different kind of way or remove it piece by piece and let it kind of fill the neck with other tumor cells and things like that, that disease will come back and will kill her and take her life. And so it's so important to do that operation correctly. And the only way you know how to do that is from your teachers and from your experience and from preparation for that operation, which in her case, it was 4 operations over 2 days in order to working with other surgeons too, to assist me because I don't work in a silo for these complex things. It's a multidisciplinary team that we work together in order to achieve these things for our patients. So it's the ones like that that really stick with you and you say, wow, I'm so honored to have been a part of this person's life at this time and in this stage and be able to hopefully help them live for a nice, healthy life.
And before the show, we were talking about this, just the advancements and what used to be done and now what's being done on spine and brain. Can you touch upon that? I mean, even just in your career, like what the advancements, the changes in some of these things, because I mean, it's beyond obviously what we ever touch upon, but I think it's so powerful for people to know that the less invasive and, these advancements, you can get cures and you can get, better functionality and less, recovery and everything, correct?
Yeah, absolutely. Faster recovery, less blood loss, less pain after surgery, more like outpatient surgery and going home the same day, a few hours after an operation instead of being in the hospital for days and recovering for weeks and months. So for sure, there's been some major advances. I think I'll talk about spine surgery specifically with regards to that. So for spine surgery, the advance of minimally invasive spine surgery, which is using approaches that reach the spine without compromising the other supporting structures and tissues. So our spine, of course, is surrounded by muscles, ligaments, and things like that that help support it. And if we can reach the spine and address the problem in the spine without disturbing and disrupting all those things, we can really improve patient outcomes and decrease the risk of requiring further operations down the road in the spine. So I always try to pursue and use minimally invasive spine operations whenever possible. And that's almost always possible. And so I always try to do that for my patients whenever possible. So that's one big advance. The other major kind of category of advances, I think, in spine surgery is motion preservation. So the ability to, instead of doing a fusion, to instead do a disc replacement, particularly in the cervical spine. We've got excellent long-term
Can I
data.
stop you?
Absolutely.
And just to explain further to our audience, So all due respect, we got to dumb it down a bit, just in the sense of this. No. Yeah. But just because I appreciate this, I get this, my audience knows this a little bit. I've brought it up a few times. We're going to talk about more, but I've been through this. So you're structurally going into a spine and to obviously, tissue there, and what it used to be would be, right, they would fuse them, and this would cause motion issues, right, and limited motion, and so explore that just for us a little bit, so that what's the difference now and what you're doing.
So such a complex topic, and I definitely want to make sure our audience and your audience understands this. So fusion is not a bad thing. I like to tell my patients fusion is not a 4-letter word. All right.
Right.
So fusion, if you need a fusion, that's definitely what you want. So some people's problem is abnormal movement or joints that have become so overgrown with arthritis, which happens with time, that, or it could be trauma or whatever else, that they need to be removed. Those joints need to be removed, and that level, that joint, that disc, whatever it is, needs to be stabilized and fused. And that's actually a very useful thing and a great tool that we have, and it involves putting in screws and rods or plates and screws and things like that. But if that's what a patient needs, that's absolutely what they want and what they should have, and they shouldn't be afraid of it because nothing else will fix their problem. But what I was referring to a disc replacement is that it used to be that we didn't have an option to do disc replacement. Okay. We always, like, if you had to deal with this problem, you have to do a fusion then because the disc would be gone and there's nothing else you can do. But now with artificial discs, particularly for the neck, but also for the lumbar spine, you can do a disc replacement, a joint replacement, where you can remove the patient's normal disc, even though it's not normal because there's something wrong with it, which is why they're having pain and symptoms and things like that. And you can replace it with an artificial disc that would maintain normal movement and mobility. Because you're absolutely right. When you do a fusion, you lose some range of motion. Not a lot. A lot of people think if they have a fusion on their neck, they won't be able to turn their head or whatever. But you, as you've shared with me, you've had a fusion on your neck. You can turn your head just fine. You can drive. You can look over your shoulder. You can do everything. And so you don't lose that unless we have to fuse the skull to the neck, which we sometimes have to do. I just had to do that last week for a patient.
Wow.
And sometimes we have to do that. Those people do have to turn with their shoulders, and to look. And it's a lot harder to check your blind spots and stuff. But in general, 1, 2, 3 level fusion, even in the neck or even in the lumbar spine, doesn't change your mobility that much. And if you need it, that's what you want. But you definitely want to be seeing a surgeon if you have a problem in your spine that does all of these things and has the full spectrum of tools available to treat your problem, whatever it may be. If you're seeing somebody who can only do one kind of operation,
that's probably what you're going to get.
That's probably what you're going to get. And so that's always an issue, So you really want to spend your time, instead of spending your time figuring out what operation do I want on my spine, which you really shouldn't be trying to figure out. You should be trying to figure out who do I want to see for my spine. That's where you want to look at, the internet if you want, look at, ask your friends, ask your neighbors, ask your doctor, whatever it might be, and figure out who to see, and then say, I'm going to put my trust in this person and take the recommendation. Because if you doctor shop, which people like to do sometimes, say, this is the operation I want. I've read about this. This is what I want. And you go from doctor to doctor till you find somebody who'll do it. I promise you will find somebody who'll do it.
For sure.
But it won't be the right thing for you. So what you want to do is find somebody you can trust, somebody who's got a good reputation, somebody who has the entire arsenal of all the different tools available to treat your problem, who can give you the best advice for, I think this would be the best thing to treat your problem. And the recommendation might be that this isn't something you need an operation for. You need to go do therapy, you need to do an injection, you need to do whatever else it might be.
Yeah. And actually, something you just made me think of that I often tell my patients is, in whether, they take my advice and go where I refer them, or they find somebody, I say, ask them, specifically, because sometimes people don't ask enough questions, how many surgeries they've done, how long they've been doing it, and what is their experience in this kind of case. And the only reason I say that is because, and you're obviously extremely experienced in things, but sometimes it's it's either a new, but honesty can, they make the choice, just have all the information there. But sometimes, like you said, you go to somebody potentially and it's a one size fits all. Or if it looks like, I do fusions and, that's what you need, and there's no other option or even discussion. So I think you got to ask, what their experience is and the volume and all that stuff.
I think that's very good advice, and it's sound advice. And doctors, like anybody else, can sometimes fall into a pattern where, like, they do a certain operation and this is what they do, and they just think that everything can be treated in this particular way. And instead of saying, hey, I can treat it this way or this way or this way, and which way is the best for this particular patient. So I like to tell my patients I can do every operation on the brain down to the sacrum and pelvis where the spine attaches to the hips. I can do those operations from the front, I can do them from the side, I can do them from the back, I can do them the old-fashioned open way, I can do them minimally invasive, I can do whatever it is that is best for that patient and their condition. And it varies from patient to patient, so it's good to be able to get advice from somebody who can do that. And, I don't want to knock young surgeons, because young surgeons can be excellent, very good as well. Obviously, I was young one day, and somebody had to be my first operation.
Right.
But that was actually a very dramatic case. My first operation was an incredible case. A young man who unfortunately was in a terrible motorcycle accident. He was riding his motorcycle, he hit a curb, and his bike flipped over him and broke his spine, where it was completely separated in half and was kind of sitting on top of it. That was my first operation as a neurosurgeon.
Wow.
After having graduated and completed my training. So that was 15 years ago now. He was paralyzed from that injury down. There was nothing that could be done about that, but his spine had to be put back together just so he could sit upright and he could breathe and he could do all those things. And so thank God his operation went great, and he did very well. And we still talk every once in a while. He's got a daughter that's the same age as my younger daughter. He's done real well. But they can be very challenging cases. But if you're well trained, even if you're a young surgeon, you can do a lot of great things for your patients.
Yeah. Wow, that's a big first one.
Yeah, it was a little bit scary.
Yeah.
But by the grace of God, we got through it.
Yeah, great. So, speaking of this, and the word on the street, by the way, from other physicians I know that know you did some work outside of the country.
Yes.
Yeah. So tell us about that. What have you
Well, yeah, I've done some missionary work.
Yeah.
It's been a great honor to get to do some work in Africa and some other places with colleagues of mine. The people who really inspire me are my friends in medical school who have spent their whole life in Africa and in other countries, just serving people who need help, who can never get the level of care that we take for granted here, sort of. So those people are definitely my inspiration, and I try to be of a tiny bit of service to them, in addition to supporting them financially and in prayer or whatever, but also just going and visiting them and helping them a little bit and working with them.
Yeah.
And they'll send me cases where they want advice because you've got general surgeons out there having to do brain surgery or whatever because there isn't anybody else,
Wow.
And so we talk through some of that stuff, and
Yeah.
those people are incredible. Those people can do anything.
Yeah.
Those surgeons who spend their lives out there. So thankful that they're out there in the world. But yeah, I've done a tiny bit of that, but not nearly as much as them. So
Yeah, no, that's exciting and how rewarding too to just be able to help others and kind of get into community that's not so underserved, in something.
Yes.
So, well, can you tell us about cases that that currently, that more modern and stuff that have really, or in the recent past year, that have really made a big impact as far as the patient, and then in that question, I mean, is like, what is the secret sauce after surgery? So, in your experience, there's people that you did the surgery right, everything was perfect, they were the best, look like outcome, but maybe something they didn't do or something, so
Sure.
Because that's a big part. That's
Absolutely.
a big part. Yeah.
Absolutely, yeah. I would say that it is usually what we hear from patients is, I wish I had done this sooner. If you're seeing me and I'm recommending an operation for you, that means that I can help you with that operation. There's something structurally wrong with you that isn't going to get better with some of the other treatments that are available. And we'll need an operation. And once you do that operation, you do feel a lot better. But one of the caveats that people don't realize is that, when a surgeon like me, for example, is doing a spine operation, we take pressure off of a nerve or something. All we're doing is taking the pressure off that nerve. That nerve still has to recover. And it takes time for that nerve to recover. And if you've been suffering with this pain for a year or two before you come in to have that treated, that recovery is going to be slow. You're not going to wake up and say, I'm cured.
Yeah.
It's going to take a while for that nerve to heal and get better. So sometimes that's a point of frustration for patients. They have to bear with that.
Well, and if I can interrupt you, because this is slightly unrelated, but you just made me think of something that in a primary care setting or in, like a preventative setting that we do, I'll get patients, and I just want you to touch upon this because, believe it or not, even though I'm always looking at root cause and the safest, easiest resolution of something, but if something, I believe in structural issues and they have to be fixed and worked on, et cetera, but I will have somebody that has a neuropathy, has a neuropraxia, has a weakness, and symptom-wise for the audience, tingling, numbness, maybe a tiny bit come and go weakness and that. But that is a sign of something structural on the nerve root, usually, or the spinal cord.
Absolutely.
And you just put me through, which we'll talk about a little bit of a spinal cord test before we went on the air.
Yeah.
And but if that goes too far, goes too long, like somebody's just putting up with what they think is a sciatica, or my fingers are a little numb or tingly, or I drop a coffee cup once in a while.
That's a danger sign. Yeah.
And it could become permanent.
Absolutely.
Or worse.
Absolutely.
Right.
Yeah.
Can you?
Absolutely. Yeah. We all know about like spinal cord injury when somebody falls off a horse and breaks their neck and they're paralyzed. Well, we know about that. But we're talking about chronic daily spinal cord injury that can happen from arthritis in the neck that's left untreated. So if you have numbness, tingling going down your arms, if you're dropping a coffee cup, if you're having trouble holding onto your pen, buttoning your clothes, things like that, that is a major warning sign. That is your body screaming out, red alert, we need to do something because your spinal cord is probably being crushed. You have what's called cervical myelopathy. And that needs to be addressed because it will cause permanent damage.
So even if, not to interject, sorry, but even if you go in, excellent surgeon goes in, does the right thing structurally, does everything right, they may come out with better, but still that permanent neuropathy or that permanent weakness or something because it's gone on so long.
And hopefully we catch it before then.
Yeah.
And thankfully in the civilized world, as long as there isn't too much fear-mongering about spine operations or things like that, people go and get the care they need, and their doctors send them to get the care that they need. When they start developing these symptoms, that can be salvaged, and they can have an excellent recovery and recover all those things. But yeah, sometimes you can't recover them. Sometimes we don't get a patient sent to us until things are so far gone that it's always going to be an unsatisfying result because so much damage has already been done.
Yeah.
And so it's so important to see a spine surgeon at a time. Doesn't mean you're going to have a spine operation, but see what's going on. And we can look in the MRI, look inside your body with that MRI. look at that neck, look at that back, whatever it is that's going on, see if there's something structurally wrong that isn't going to go away with medication or with therapy or with stretching or whatever it might be, and address it if it needs to be addressed to protect yourself and protect your function. You get one spinal cord, no one can replace it for you as far as I know.
Yeah.
So
So
you want to keep that healthy and safe.
Yeah. And I think it's probably my space, my audience. That's why I'm bringing this up is, they're looking for, more of a natural, and they want to keep living and thriving and energy and all this stuff. And surgery sounds scary, but you said something, and this is whether it's hip or, a shoulder or whatever. I just had somebody literally this week. I was like, I wanted to shake her and go, you got to do the hip surgery.
Yeah.
I mean, you're way overdue for a replacement. What are we doing?
Yeah.
And they say it all the time, even in my practice, but they don't really realize it. They need the surgery.
Yeah.
And they'll go, oh God, I wish I would have done that earlier.
Yeah.
I mean, I hear that over and over.
Absolutely.
And
all the time.
and not that again, I'm pushing people to go, but just go see people if you have some of these weaknesses and chronic pain and things like this, because again, it leads into so many things that affect your whole system.
Absolutely.
And this person I'm speaking of, which is a hip, I know it's not your field, but literally is not sleeping as well. It doesn't work out now, so she's gaining weight. So it leads into all these other things.
And it causes a deterioration in your health, basically.
Yeah, for sure.
So you have to remember, a spine surgeon's job, or really any doctor's job, is to restore you to good function and health. That's what we're there to do.
Yeah.
We want to protect your ability to walk, to use your arms and legs, to do all those things for the rest of your life. You can't possibly be healthy if you can't walk, if you have to have somebody push you around in a wheelchair. That's going to be a problem. You're going to, your entire health will deteriorate. Like you said, there's people who are so afraid of surgery sometimes that they would rather spend their life being sedentary and inactive than having a normal, healthy life, because that it would take a surgery to get back to that. And they're so scared of that. But what they don't realize is that results in diabetes, high blood pressure, congestive heart failure, all associated potentially with obesity and things of that nature that happen because of lack of activity and lack of being in a physically engaged life where you're physically active and engaging. And that can result in, a lot of other health problems. So you should have your problems addressed if they need to be addressed.
Yeah. Excellent. So this is a little bit off topic, but doing 700 surgeries roughly a year. And again, being a top doc in our state for sure, but 150 neurosurgeons, and you're in that top league there. You physically, it requires you to be in shape.
Yes.
Physically demanding. I've been in surgeries. I mean, a long time ago when I had hair and everything. But I mean, let me tell you, just general surgery, simple orthopedic, it's not easy. Over the table, all that. So how do you and what do you do to stay healthy and fit, and what's your basic routine and stuff that you do?
Yeah, no, that's a great question. You're absolutely right. It does require a certain, physical stamina and strength to do the operations that we do and that I do on a regular basis. So I definitely do everything I can to try to take care of myself. I certainly eat healthy. I don't eat any junk food. I go to the gym at least 5 times a week. I work out. I used to play basketball up until about a few years ago. I kept breaking fingers, and my wife said no more.
Oh, that's gonna that wouldn't be great for your career.
Yeah, exactly. So I've switched to pickleball, but I know a lot of older people play pickleball, but I play with a lot of younger people, and they keep me on my toes, which is great. So that's how I get my cardiovascular workout. But weight training is very essential to maintain a certain, and you know this, and I'm sure your audience knows this, to maintain a certain muscle mass that allows you to have a high basal metabolic rate, so that you can eat a normal diet and not put on a bunch of weight. Because one thing that hopefully is obvious for your spine health, you have to stay light on your feet. You can't ask your body to carry an extra 100 pounds and expect it to not deteriorate. So it is important to do what we can to try to stay in shape and stay physically active and healthy.
Do you find that surgically, and this is obviously mostly with spine, basically, do you find that some of the post or the people that do the best are the most active?
Absolutely.
Okay.
Yeah. Those patients have a faster recovery. Sometimes they don't need a rehab stay. If they come into the operation healthier and fitter, that's going to help them recover for sure. Absolutely. You did ask me something earlier that I did want to touch upon, is this idea of not having any pain after surgery. It's okay to have some pain after surgery. When you have an operation, someone is making a cut in your body. You're asleep, of course, under general anesthesia and everything. But we have to make a cut. We have to work in there. We have to do something. It is absolutely normal to experience some pain after surgery. And if you go in with that expectation, you're going to have a much smoother time afterwards. You're like, oh, no, I'm feeling pain when you wake up from surgery. And you panic and you need like to be, put on all these medications. You're not going to do well. You need to understand, I'm going to have some pain. It's a normal part of the human experience. I will recover from it. I will heal. I will get better, because you will. And it's important to go in expecting that. You asked how the difference between people who do well and people who don't do so well after surgery is the people who have the correct expectation of like, okay, I know I'm going to be uncomfortable right after the operation. It's okay. It's an operation. I'm going to get through it, and I'm going to get a little better each day.
Yeah. And I personally experienced that and lived that. And, I'll have you in a minute review my MRI here, which you actually have the disc and everything. You can really, but by the way, you have to be kind, because if you really sound really scary, my wife's going to just shut me off. I mean, she'll be like, you're not doing this, you're not doing this, you're not doing this. So
she's going to wrap you in bubble wrap.
Yeah. So definitely be kind. But when I had an emergency surgery in my cervical spine, it was probably 2-3 months in, I still had some pain. I mean, nothing major, taking Tylenol and stuff, but I was very active. And I can remember going to get a second opinion, and great orthopedic spine surgeon. And I just knew, and I went to his office, and he didn't do my surgery. I just wanted to get a different, and he's like, yeah, this is normal. Like, but I wanted, I thought, well, is this normal? I don't know. I mean, but it was fine. It just took a little more time in that, but it's okay to have some pain. Your body's telling you something. And it's also, God's way right of saying, slow down a bit, let's recover.
Yeah, that's a really great point that you just made. If you're having pain, shooting pain down your arm, shooting pain down your leg, severe pain in your neck, severe pain in your back, that might be your body saying, hey, pay attention, something's wrong. And you need to get it checked out. And if you get it checked out and everything looks okay, then you can kind of have some relief, and hopefully you can work through some ways to decrease the sensation of that pain. But that's your body's warning system to say, hey, something might be wrong here. Get this looked at.
Yeah, and I always stress to my patients, because we do these things with peptides, and even actually I've noticed immensely just balancing hormones in women and men in their middle-aged. They'll get reduction in arthritis pain and things like this. And we have, nutraceuticals, herbs, all these things. When that works, great. But if you're having neuropathic pain, that's where it's, when you're having weakness or numbness or dropping things or tingling and all that, you got to get that checked out. Or if it's interrupting sleep or, what have you. So do we dare go into my MRI?
Sure. What's the best way to do that?
Well, let me tell the story. You can pull it up here. Roughly, I think about 18 years ago or so, I had an injury while I was mountain biking and racing mountain bikes, being a doctor, being a dad, etc. A little too much, probably, but this is what I was doing. And my neck was bothering me and hurting me. Never got an MRI like that. Went and saw a few people, and and when I look back, it was actually causing some chest pain, some arm pain. Like I was getting some radiculopathy. Wow. So, in retrospect, it was happening. But me and my son, he was 8 at the time, were at this camp, and I dove off this platform about 25, 30 feet, which I'd grown up at. Didn't hit anything but the water, but the torque on my neck and my shoulder ruptured, a major disc, blew out onto the nerve root, big herniation, and, basically, massive pain in my left arm, and et cetera. So anyway, within, bore the too many details, within 24 hours-ish, I was at St. Joe's having emergency surgery by Dr. Croissant. And I told you, I woke up, he took me from 20 out of 10 pain and tears with morphine to when I woke up, it was gone.
That's wonderful.
Yeah. And when I saw him in a restaurant, literally in Boyne City, near Charlevoix, I saw him, bought his family dinner. And, this is years later. I just ran into him and kissed him on the cheek. I said, God bless you, man. I love you. Because I was lucky, by the way, to get a great surgeon. And he's retired now and that. But it was, I was fortunate to say I didn't suffer up to that, but I truly appreciate these things. And because of this being so long ago, I have some issues that have developed. And even though I still work out and very active and all that, I find I'm better with movement and exercise and strength and maintaining, the structural stuff and mobility. I do a lot of massage and all that stuff too. But I put you on the spot to get a free consultation. and it's going to cost me a lot, I'm sure. And sent you my MRI. That was from last year. And because what is exactly what we were talking about earlier is when you have a fusion, so I had an emergency, essentially fusion. And I'm grateful for it, by the way. But, the wear and tear because of just the, skeletal system, the wear and tear, and that you get axial load on it above, right?
Right.
So how ugly does that MRI look?
So yeah, your MRI doesn't look so hot. You look a lot better than your MRI, so that's good. You can see the previous fusion you had extending here kind of from C5 to C7 on this MRI. And then just above it, your disc height is very well maintained, but you've got a pretty huge disc herniation that's pushing your spinal cord. And here's the front of your neck is here, the back of your neck is here. We're looking at you from the side, and you're kind of facing towards me, facing this way here. And these are the bones of your neck, these gray squares. The discs are the black, and the spinal cord is this gray thing. And it's supposed to have this bright white space in front of it and behind it like it does up here. Here, you've got this huge disc herniation, or pretty significant disc herniation, just above the area of your previous fusion. And that's at the C4-5 level. And it's pushing the spinal cord and kind of giving it some distortion there and pressing on it. So thankfully, you have a tiny bit of cerebrospinal fluid space posteriorly, so it's still not crushing your spinal cord so much that it's causing you damage, which is why you're still able to do all the things you're able to do. You're a very active guy. You're weightlifting. You're healthy. You're exercising, doing all those things. But it is something to be mindful of, for sure. Yeah. If you have progressive numbness, tingling in your arms, if you're having some balance issues, things like that, or increasing pain in your neck, it's something that would need to be addressed. And because your disc height is so good, what somebody like me would do for you is actually a disc replacement, where I'd remove this disc herniation and I'd put an artificial disc in here, which is like what we were talking about before, that would help maintain all the normal movement that you still have of your neck. You've lost a little bit of movement from the fusion that you had before.
Yeah, because my fear, which we were talking about, was, a fusion above, which then you get just your, loss of motion and everything, and then the load gets taken up right above it.
Right. And so an important thing to note about that, a lot of patients ask about that. Oh, if I get a fusion, am I going to need a fusion at the next level, And the answer is maybe. I mean, the reality is we can't take patients who need a fusion and say to them, hey, we're going to randomly assign you to either get a fusion or to not get a fusion. And we're going to check in with you in 10 years to see if the disc just above, the one that needed a fusion 10 years ago, is now bad, or if it's okay. And we're going to do this other person, we're going to treat them, and we're going to help them feel better. And then we're going to check whether in 10 years they have a problem at the level above. We can never do that study because it's not fair to make that person suffer for 10 years and not treat them just to see will the level above change in 10 years versus this person who had the operation. So we'll never know that information, but you have to remember that as we continue to live on this earth and gravity takes a toll on our bodies, arthritis continues. And so it's not abnormal that if you have degeneration at one level, that over time you may get degeneration at another level anyway. Fusion probably kind of exacerbates that and speeds that up a little bit. And expedites that degeneration. So ideally, you preserve motion whenever you can, but doesn't mean that that's what caused it necessarily. It just means you're somebody who's potentially predisposed to it, and you may develop a problem at another level. Yeah. That being said, can I dive into minimally invasive spine surgery's advantages when it comes to that?
Yeah.
So about in early 2023, about a couple of years ago now, I published a study in World Neurosurgery looking at over 2,000 patients that we followed for a minimum of 5 years. And we compared patients who had minimally invasive spine surgery to patients who had traditional kind of open spine surgery, which is a midline incision that involves like a cut down the middle of the back where the muscles and ligaments and everything are kind of removed from the spine just to get to the spine and address the problem. That's sort of the collateral damage of kind of the traditional open approach, which I sometimes have to do too, depending on what it is I'm treating. But in general, I try to avoid that approach. Minimally invasive spine surgery means making little incisions, muscle-sparing incisions. You take tubes and dock them onto the spine right over the area where the problem is, and that way all the muscles, ligaments, and everything stays attached to the spine. So all those support structures stay in place. And what we found in this study is whether you were having a decompression surgery or a fusion surgery, when you have it done in a minimally invasive fashion, your chance of needing a reoperation after 5 years or a minimum of 5 years was less than half of the patients who had the open spine surgery. And I think that's because the support structures are still there. We haven't proven that, but that study helps prove that.
Yeah. It makes physiologic sense.
It makes sense. It makes sense. And why would you ever want an operation where all those things are removed from your spine if you can get to the spine and address the problem without removing all of those things?
Right. Yeah. And one of the things to me, too, is you said it, and I've mentioned it many times, is just no matter how long we live and no matter how well we live, gravity's going to win.
That's right.
So you're not getting out of this with probably some spine pain, joint pain, hip, knee, whatever. And, fortunately, we have all these advances. I mean, fortunately, we have, minimally invasive stuff. We have, hormones, peptides, nutrients, great surgeons, all these things. But don't let it slow you down. I mean, that's always the take home.
Yes.
You got to, don't rush to it, but, seek help and really get the appropriate care you need, because that structural component can be just huge and life-changing. When I look back, knowing what I know now again, I had a trauma,
Right.
but I suffered for about 2 years, and not to the degree where it was massively affecting my life, but enough to where it was very noticeable almost every day when I look back.
Yeah.
I just was like tough and trying to deal with it.
Right.
And like, I'll get through it, and, it'll be better one day or one day. And, obviously, so it was inevitable, I think, that was going to happen,
sure.
but so, anything else you want to touch upon that you think is like, I'll call it the secret sauce or something that's new, just that, you want patients to know about, any neurosurgery, in general, anything that's, or even, difficult for you that helps the patient know, how they should approach or handle something.
Yeah, I think, again, the major thing is one of the things that is most difficult to deal with is if you have somebody coming into your clinic already determined that they know what it is that they need or what's wrong.
Do you see that a lot?
A lot.
Do you
a lot.
really?
And it's only going to increase with AI.
Okay.
People are going to come to me with an AI prescription of what it is that I should do for them.
Yeah.
And it's like, well, then why are you coming to see me? I mean, you're coming to see me because I'm a board-certified neurosurgeon. I assume you've heard about me from someone somewhere. Your doctor told you to come see me. Your neighbor told you to come see me because I took care of them and helped them. So listen to what your doctor has to say. That's why you're there. That's why you're paying for the visit, right?
Right.
So take advantage of it.
Yeah.
So go in with an open mind, knowing that, there is something wrong, and you've read some things on the internet. They may or may not have anything to do with your actual problem. That's the most frustrating thing, is that if you're reading about a solution for a problem that isn't your problem and you have a completely different problem, that's not really particularly helpful. So
It can be very cloudy and confusing, actually.
Absolutely. And it will bias you to potentially reject the advice of a doctor, the excellent advice potentially of a doctor, because this is specifically what you want. This is what you've determined is wrong with you, and this is what you want to have done. That's not what you're looking for. If you're looking for a surgeon who'll just do whatever it is you want to have done, then, I'll send you to somebody who'll do that. There's people who have absolutely nothing to do. And if you walk into their office saying, I want this operation, they're like, okay, I'll sign you up.
Right.
But you'll never get something like that from me or from any of the many great doctors who are in Southeast Michigan. We're so blessed to have so many great doctors around here, and around the country, there's so many great doctors as well. You want to go see a doctor who you can trust and present them with your problems, what it is you're experiencing, and let them tell you what they think is going on with your body, and how they might be able to help, what the different solutions are, and whether it's an operation or something else. So go in with an open mind, take advantage of your doctor. Your doctor's one of the main role for us as a physician is to educate our patients, and you do this every day. So much of what we do is to help them understand what's wrong and to help them understand their different options for how to treat it and what's available to them. Because ultimately, it's their choice. They're in charge, but we're there to help them, help to educate them, and help them understand their bodies better.
Well, and you said something that I didn't really think about surgery. I don't know. I didn't put the two together, but because people do come, of course, in our practice all the time, and hey, I think I need this. I think I have this. What do you think of this supplement or this peptide or this, treatment that's out there because it's on Instagram.
Right.
I didn't think about it with surgery. That's interesting.
Absolutely. Yeah.
And they trust us. That's why they're there. And again, just like you said, but yeah, you should listen, and you've they're giving you your time and you're giving them their time. So get value out of it, not just, hey, here's what I read and what I need, because it's already been, I can tell you, because one of my docs loves AI. He's not using it per se, but he loves to dig into it and see what it says. And I will just tell you, in a medical sense, it's often
completely wrong.
Yeah, it's way out in the weeds. I call it. Yeah. It's like, okay, wait, that's kind of so. Well, that's good. That's good info. Yeah. Well, Dr. Fahim, hey, I appreciate your time. Man, this has been great informative to our patients, especially people that might have some stuff out there that need help. Where can they find you? We're on staff, and I know we're on staff together at some places, but what's the best way for them to reach you or to get info on seeing you if they want to get a consult?
Yeah, absolutely. Yeah, happy to see new patients and evaluate them and give them my advice and recommendations. You can find my location. My office is currently in Royal Oak. I work primarily out of Cornwall Health, William Beaumont University Hospital, where I'm a professor of neurosurgery at our medical school there, and I teach, of course, the medical students and the residents there. But you can come see me in my clinic in Royal Oak. It's called Spine and Brain Surgery Specialists. My website is www.drdanielfahim, drdanielfahim.com. And my phone number is pretty easy to remember, 866, and then Dr. Fahim, Dr. Fahim, 866 Dr. Fahim. So
wow, I should have got to that. I wasn't that ahead of it.
Yeah,
you
probably still get it.
You probably help me out with that one. I like that. Yeah. My staff will love that I'm changing our number.
Oh yeah, they'll love that. But yeah, absolutely an honor to be here with you. Really fun to talk through this. I'd love to come back and talk again about anything that I can be helpful to help illuminate or understand.
Well, sometime we'll probably get into. I'll pick your brain again. We'll get into.
No pun intended. Pick your brain.
Correct. Yeah.
If anyone's picking anyone's brain, I'm picking your brain.
That's true. You are picking my brain. Yeah. There we go. Yeah. But about some maybe cancer or brain stuff like that. That'd be great. But thank you again for your time. Out there, hey, what a value here. Appreciating structure and pain and spine and all that stuff. And remember, gravity will always win. So protect yourself. Keep being healthy. Support yourself, from all the 6 points of the model, and movement and maintaining strength and mobility and flexibility and all that is so important in this. Thanks again, Dr. Fahim. Join us again on the Deep Six podcast, and we're here to make you thrive and not just survive. Be well.